Etter Health Center proposed a cut on operating hours to the Student Senate. And what could this mean for students? SUTV reporter Luke Martin has more.
Etter Health Center is considering cutting weekend hours. The reason is that students just aren't coming in and nurses are staying late for nothing. The cuts would change hours from 7:30 to 11:30 to 10 to 6. Dr. Johnson Coyle, the director of student health, says that the bottom line is that the staff doesn't see late hours as a good use of student money.
What we found is, surveying the students that come late at night and early in the morning, they don't generally have urgent conditions anyway. It's really more for their convenience. So our thinking is that there won't be any adverse impact, that the health care will be the same.
The concern, however, is that the students who are very sick late at night would be at risk. Dr. Coyle says that Etter wouldn't even be the place to handle these kinds of patients.
So the health center is really only for medium injuries. Somebody who's medium could benefit from evaluation in the middle of the night. But a seriously ill student would go by emergency medical transport that would be called by the campus police.
Even though they're cutting their hours, Etter still wants to receive the same amount of student funding. Student Senate President Comfort Dixon just wants to make sure that the proposed cuts do not endanger students.
Parents are sending students to a university in hopes that they're taken care of, and that's what we want to reassure parents, that they are getting taken care of. Do we want to save money or potentially save someone who's sick?
For SUTV News, I'm Luke Martin.
All right, thank you, Luke. The Student Senate will be voting on the cuts next Thursday, but before that, SUTV News would like to know what your thoughts are. Log on to our Facebook page at facebook.com/SUTV News and post your thoughts or comments about the new hours. We will be reading some of your responses at the end of tonight's show.